Developmental abnormalities associated with salivary glands. So, in contents we have agenesis, aplasia, aberrancy, hyperplasia, atresia, congenital fistula, diverticuli, accessory parted ducts, Staphnase cyst, and Darius disease. So, what is agenesis or aplasia? It's the absence of one or a group of salivary glands unilaterally or bilaterally, or the complete absence is rare. Often occurs with other craniofacial abnormalities like mandibulofacial dystosis and hemifacial microstomia. So CT scan or MRI indicates the absence of the gland and the presence of fibrous and fat tissue. So clinical features include xerostomia, enamel hypoplasia, dental caries, early loss of teeth, cracking and fissuring at the corners of the mouth. Management is good oral hygiene. Aberrancy. An aberrant or an ectopic is a salivary gland tissue that develops at the site where it is normally not found. So clinical features. It is usually seen at the cervical region near the parotid gland or the duct or the body of the mandible posterior to the first molar. So clinical significance, it can be the site for the development for the hyperplasia. Unusual localized hyperplasia or hypertrophy of minor salivary gland is in the palate. So the clinical feature is the small localized swelling measuring from millimeters to 1 centimeter in diameter on the hair palate. Lesion has an intact surface, firm, sessile and normal in color, asymptomatic, and patient is unaware of the lesion. Treatment is surgical excision. Atresia, congenital occlusion or absence of one or more two major salivary gland or duct. Site, submandibular duct in the floor of mouth. There is a severe xerostomia in atresia. Next is the congenital fistula. Sinus tract from either in crease behind the pinna or in front of tragus. Management, complete surgical removal. Diverticuli. Diverticulum is in a pouch or a power sac protruding from the wall of the duct. It causes saliva pooling and sialadenitis. It is diagnosed via silography. Accessory duct. Its accessory duct is another additional duct that is developed and the most common developmental anomaly. The most common stage is superior and anterior to Staphnase bone cyst, also called as Staphnase cyst or defect or lingual mandibular bone cavity, static bone cyst or latent bone cyst. It is an asymptomatic mandibular depression associated with ectopic salivary tissue, common near third molar below mandibular canal, and occurrence is 0.1 to 0.48%. Diagnosed via radiography, may require CD, CB, CT, MRI and FNA biopsy. Etiology, possibly due to pressure from adjacent glandular tissue, inclusion of salivary gland tissue during mandibular development. So Staphnase bone cyst is nothing but just a mandibular depression that is seen here. So in the next picture, we can very well see the Staphnase bone cyst that is associated with the mandibular depression. Next, coming to Darius disease, which is also called as keratosis follicularis. It's nothing but we have here we see the oral manifestation that is associated with the occasional obstructive sialadenitis. So what is Darius disease? Darius disease is a genetic skin disorder with wart-like blemishes, causes mutation in ATP2A2 gene. Symptoms is also occasional obstructive sialadenitis. Impact on salivary glands. Minor salivary glands can be affected, altering salivary duct flow and duct dilation and periodic stricture. Xerostomia, dry mouth due to the gland involvement.